Good evening, everyone. On behalf of our PPDSI President, Dr. Paul Abaya, our PPDSI officers, the technical and organizing committees, our partner, the UP College of Dentistry, and their sponsors, Unilab and PharmaHex, I would like to welcome you all to our String of Pearls webinar series. We are all honored and privileged to have everyone with us here tonight. Thank you very much. For tonight's webinar, we will be having two lectures. We would like to inform everyone that we will reserve all your questions and allow our lecturers to answer them at the end of both lectures. We are kindly asking you to post all your questions in the chat room at any time during the lecture. Please do not forget to complete the evaluation form and the 6-item questionnaire at the end of the lecture. Certificates will be issued only to those who have completed and submitted both. This webinar will be credited by the PRC under the Self-Directed Learning Program. At this point, I think we are ready to begin. Tonight's first lecture will give us an overview of the changes that occur in adolescence, its physical, pubertal, psychosocial, and cognitive aspects. It will allow us to understand these rapid changes and help us decipher the puzzling behaviors of adolescents, including becoming moody, secretive, argumentative, and prone to risk-taking. This lecture will also present recent statistics on adolescent risk-taking. Our first speaker for tonight completed her medical degree at the Cebu Institute of Medicine and underwent fellowship training in adolescent medicine at the Philippine General Hospital. She obtained an honorary fellowship in adolescent medicine at the Children's Hospital in Westmead, Sydney. She is currently the chief of the Adolescent Medicine section at the Department of Pediatrics of the Philippine General Hospital and a clinical associate professor at the UP College of Medicine. Our speaker is the president of the Philippine Society of Adolescent Medicine Specialists and the past president of the Society of Adolescent Medicine of the Adolescent Medicine of the Philippines Incorporated. Join me in welcoming our speaker for tonight, Dr. Maria Emma Alesna-Llanto.
Hi, good evening. Good evening and thank you for this invitation. So do the participants see the picture on the screen of this teenager?
Yes, ma'am. Actually, someone shared that the adolescent in the picture is angry. She seems to be ranting, annoyed, and rebellious.
Yeah, okay. Yeah.
And perhaps irritated. And someone described the adolescent as a brat.
A brat, yeah. Okay,
Yeah.
So our mission for tonight, and you have accepted it, guys, is to understand the creature that you just described in the previous slide, no? And although many think that it's mission impossible, I would like to tell you that it is possible. It is possible, maybe not 100%, to understand adolescents. They are a mystery at some point. No, we cannot understand all about adolescents. But I think maybe enough to make life easier for you, your patients, and perhaps your own adolescent. So these are the objectives of my talk. By the end of the session, participants will be able to identify key points in normal adolescent growth and development and how they present to adults, discuss anticipatory guidance with parents of adolescents, and ultimately, I hope that by the end of the talk, you will somehow regard adolescence in a new and different way. These are my resources, but I also have two adolescents as resource persons for tonight. The first is Jeremy of the comic strip Zits. He is a 15-year-old aspiring rock star who is navigating adolescence with his parents who, according to him, of course, do not know a thing. Another important resource is my son Ariel, who was my first professor in adolescent medicine. When he was a teenager back in the 90s, we didn't know much about adolescence, so we made lots of mistakes that led to hard-earned lessons. Thanks, Yel. This is dedicated to you. This is the outline of my talk, and let's start with definitions and demographics. The WHO identifies adolescence as the period in human development that occurs after childhood and before adulthood from ages 10 to 19. It represents one of the crucial transitions in the lifespan and is characterized by a tremendous pace in growth that is second only to that of infancy. Globally, there are 1.2 billion adolescents. 85% live in developing countries like ours. In the Philippines, there are 22 million adolescents. At least 1 in 5 is an adolescent. But despite their large numbers, they are underserved in terms of healthcare, and I know also including dental care. We are all familiar with puberty, but adolescence is more than just pubertal changes. It's a period of amazing physical, cognitive, and psychosocial changes that happen at the same time. So it can be very confusing and stressful. It is also a period of many social transitions. We seek our own identity, start relationships, enter college, and acquire skills to eventually become, hopefully, happy, well-adjusted, and productive adults. WHO divides this period to early, middle, and late, and each has distinct characteristics. Let's start with the physical and pubertal changes. In general, puberty starts in girls at an average of 10 years, but maybe as early as 8 years and as late as 13 years of age. Note that there is a 5-year variability. So we enter puberty at very different rates, and the onset is very variable. The first sign is breast development, or THELARC. We assess pubertal development using the sexual maturation rating, SMR, or maybe the Tanner staging is more familiar. Let's go through the sequence very briefly. So although the onset of puberty is very variable, the sequence is stereotypical. That means it will follow this same order in every girl. We start with breast development at stage 2. Pubic hair appears, followed by peak height velocity. This is a very rapid increase in height. Then menarche or menstruation at SMR4 in most girls. Note that peak height velocity is an early event and a late event in boys. Another thing to remember is that the increase in height is minimal after menstruation. So the increase in height is before menstruation. After menstruation, it's minimal. Puberty in boys starts at the age about 2 years later, as early as 9 and as late as 14 years. There's a 5-year variability. And the first sign is quite subtle. I think this is in your examination. It's not voice change. It's not the appearance of pubic hair or facial hair. It's actually very subtle, the enlargement of testes. Now, testicular volume increases from 5 ml to as much as 30 ml during adulthood. Now, for boys, the puberty starts at SMR4, genital 2, and there's an increase in testicular volume and changes in the scrotum. By stage 3, there's already formation of sperms, and males experience erections and nocturnal emissions or wet dreams. Full fertility, however, is reached during SMR4. Note that peak height velocity and peak weight velocity are late events between SMR4 and 5. So, the men in the audience may remember a distressful time when the girls in class were taller. This usually is at the start of high school, but by graduation, the guys are much taller. So please assure your sons. The growth spurt is earlier for girls and will last for 24 to 36 months in both sexes. Increments will account for 25% of the final adult height and up to 50% of the ideal adult weight and 40% of the bone mass. So you can see the importance of a healthy diet in this critical period. Other changes are also the appearance of body odor, mabantot na sila, and pimples that can be very distressing. There are changes in body composition. There's a loss of fat in males and they gain muscle, but it's the opposite in females. There's a loss of muscle and fat deposition, which is entirely normal. That they should be assured, and it's important for reproductive function. Yes, it's normal for them to be like lazy bums. They eat and sleep a lot. And it's because of the amount of growing they need to do. They need 8 to 9 hours of sleep. It's almost impossible that they'll sleep that long. The thing also is that they sleep later because the secretion of melatonin is delayed for 1 to 2 hours. So it's they sleep late and they also have difficulty waking up in the morning. They need lots of calories. For boys, it's 2,700 to 3,000 calories for males and up to 2,300 calories for females. In contrast, 30 to 40-year-olds, maybe like you, need just 2,000 calories. Well, someone my age, an older adult, above 60, just needs 1,600 calories. There's need for more calcium for bone building, iron for hemoglobin and menstrual losses, and zinc for normal pubertal development. Because of the very rapid growth and development, appearance of pimples, body odor, etc., it is normal to have body image issues during early adolescence. They compare themselves to peers who are also developing differently at their own pace. Girls worry about weight, so they need to be told it is normal to gain weight at this time. Guys are worried about their height, and of course, they want to have bulbous muscles and abs. Some tips. There is an increased need for privacy. They feel very awkward about their body, so please provide this. And it is easy to trivialize and laugh at body image issues. It's only a pimple. Please remember how it felt also when you had pimples when you were younger. Be on the lookout for dieting, especially for girls, skipping meals or eliminating parts of the diet like rice, carbs, or protein. Be wary of food supplements that boys may use to bulk up. The changes can be surprising, so talk to your girls, to your kids early. Remember, puberty can happen as early as 8 years old. So talk to them about what to expect and about menstruation and menstrual hygiene. Talk about these changes positively beyond the, uy, dalaga ka na, sort of conversation. The boys are even more uninformed. Please talk to your sons about erections that can happen involuntarily and can cause embarrassment. Nocturnal emission, it is not bedwetting. What is coming out is not urine, it's semen. And it happens because the body is fine-tuning itself. And talk about masturbation. We view it as an exploratory behavior for both sexes. It is normal to masturbate, and it is also normal not to masturbate. Take the guilt out of this normal behavior, please. This is the best time to build good habits that will last a lifetime. Prepare healthy meals, model good eating habits, encourage moderate physical activity, and limit screen time. Although it is challenging at this time of lockdown, strive to establish a routine of regular meal times, exercise, chores, and leisure activities not related to gadgets. While physical changes are obvious, psychosocial and cognitive changes are more subtle. Adults have difficulty understanding these, and even adolescents themselves get confused by shifts in mood and intense feelings. I remember getting alarmed at the way I was overthinking everything. As I go through the slides, try to remember how it was growing up as a teenager. There are so-called tasks of adolescence, what we need to accomplish to become independent, well-adjusted, and productive adults. These are to establish our own identity, to be independent of our parents eventually, to accept body image and our sexuality. Identity formation seeks to answer the question, who am I? What are my own values and my own beliefs? Will I assume my parents' views on politics, religion, their way of dressing? In order to clarify these, we have to move away from our parents in a process called individuation. So this is Jeremy distancing himself from the mom. And this is manifested as a loss or less interest in family activities. I remember Ariel always wanted to accompany me to all my trips, to the groceries, to the clinic, etc. But one day he said he would rather stay home. From a funny kid, he became a sullen teenager who did not like to be hugged or kissed in front of his friends. He also became quiet, less chatty, and seemed to daydream a lot. Then he didn't want to be dropped off in front of the school gate and didn't want a goodbye kiss anymore. These changes that start in early adolescence and become more prominent during middle adolescence are perceived by parents as a decrease in closeness. It's not really. It's just your teenager figuring things for himself, and he needs to distance himself from you for a time. Middle adolescence is the time when conflicts between parents and adolescents happen. Remember, the teen is still figuring out which values he will adopt: his families, his friends' families. So arguments can arise over anything and everything: hairstyle, clothes, music, friends, chores, curfew, etc. I remember Ariel wanted to have dreadlocks one summer and we refused. He said, and he asked us, why are we so strict? The parents of my friends allow them to stay overnight. Why can't you allow me? My advice now is that now that I am a bit wiser, is to figure out which are negotiable and which are not. Curfews can be negotiated and can be adjusted as they grow older and more responsible. Hair can be restyled. Allow safe ways of self-expression, hairstyle, and the way they dress. We should have allowed him to do whatever with his hair, but use of alcohol, tobacco, use of pornography, however, were non-negotiable. But one of the painful questions that parents ask is, why does he prefer his friends over us? Well, it's hardwired in our brains. Think about how it was when you were a teenager. You always preferred your friends because they were so much more fun than your parents. In order to establish greater independence from their parents, adolescents must orient themselves towards their peers. Peers are the source of information about the world. It's where they gain acceptance and affirmation. It's in the barkada where they learn how to navigate relationships and learn skills they need in adult life. Research has showed that those who are accepted by peers have positive self-image and do better in school. So individuation does not mean that parents are less important. Teens need parents and don't want to break emotional bonds. They need and want a different balance. We should not withdraw our affection just because they seem to be less demonstrative. Many of the behaviors can be explained by the changes in the adolescent brain. Brain development does not happen only during early childhood, but continues until our mid-20s. There's a remodeling of the brain during adolescence. There's a loss of gray matter because of the synaptic pruning or elimination of synapses that are unused. So here, no? There's a pruning. For example, if you used to play the piano but stop practicing, the neural pathways on piano playing will be pruned away. So you will be less skillful because of lack of practice. It's also like deleting unused apps and files in your phone so that it will run faster. To make connections faster, the next step is myelination, or wrapping the axons in white matter to make conduction more efficient. So what's the result? Why is there brain remodeling? It results in a more powerful brain. So adolescents can learn information as much or even faster than adults. They can do abstract thinking that makes them understand concepts like justice, equality, and they can solve calculus. They are able to imagine the future. That's why they daydream a lot, and they are very creative. They are also capable of metacognition. And metacognition is the ability to think about thinking, and the ability to think about what others are thinking about them. And kids cannot do this. It's amazing. But brain development does not happen overnight. It is an uneven process that continues until our mid-20s. So your 16-year-old may look like a full-grown man, but has a brain that is still maturing. Another interesting thing is that the brain maturation happens from the back of the brain to the front of the brain. So from the back to the front. And what's the implication? So what? It's because at the back of the brain is a structure called the limbic system. And the limbic system is the seat of emotions, motivation, and reward. This is what lights up when we eat something delicious or do something pleasurable. This develops first before the prefrontal lobe, which is the seat of judgment, impulse control, future orientation that involves planning and thinking of consequences of one's actions. The connection between the limbic system and the prefrontal lobe that has regulatory functions is a late event. In general, adolescents are more impulsive, seek out, and are more influenced by exciting, arousing, and stressful situations compared to adults. In very simplistic terms, the braking system seems to develop much later than the accelerator. So how is this manifested? They practice their reasoning skills by arguing with us, and they seem to be know-it-all. They tend to see things as black and white and be very judgmental, and they even judge the way we dress or the way we talk or what we do. They can become cost-oriented also. Because of metacognition, they become painfully self-conscious. They tend to think that everything is about them, so they are egocentric and may lack empathy. Teenagers also tend to take risks. We know this already. Try to remember the crazy things you did as a teenager. Now it's our turn to worry about sex and drugs, etc. We should understand that we are hardwired when it comes to risk-taking. These exploratory behaviors are important ways for teens to shape their identities, try decision-making skills. Risks may be taken to be accepted by peers, to look grown up. No, this is how tobacco companies sell their cigarettes. While we understand that these are exploratory, we should be alert to behaviors that jeopardize health and safety. This chart shows the uneven brain development, with the limbic system in red developing first, and the prefrontal cortex in green just catching up in the mid-20s. The shaded area in gray denotes a period of vulnerability during mid to late adolescence. This is the period when we, as parents, should be present to give information, teach decision-making skills, supervise, monitor, and of course, love our teenagers. Some tips. Please, so parents and other adults can therefore provide the prefrontal lobe assist. Remember, the prefrontal lobe is not yet developed, so we need to assist them through authoritative, loving, and positive parenting. Some tips. Please communicate and talk about things that matter. They need to know what the family stand is on alcohol, tobacco, drugs, sex, what your expectations are about studies, participation in family activities, and things that matter. Remember that the brain is plastic and hardwired to learn. They are capable of learning. So provide opportunities to develop new hobbies, activities, sports, and of course, please assign chores. And as much as possible, introduce them to community service. They need to think beyond their own selves. Teach life skills that are necessary in adult life. Get teens involved in discussions, no? So that they can distill what they believe in and they're able to articulate and assert their own thinking. Allow them to decide. Don't make every little decision for them. They need to learn that. Teach them to problem solve and to accept consequences and even failure. Talk about peer pressure, and we do it this way. What if during the party somebody offers you a drink? How will you respond to that? So it gives them a way to rehearse, a, a way of, a way to rehearse, um, a way to say no and be ready with that liner. We also need to provide controlled risky behaviors. And what are controlled risky behaviors? Running for class officer, applying for the school paper, starting a project. These are risky because there is a possibility of failure. So these are controlled risky behaviors. Please avoid sermons. We all know that doesn't work. Try to spot the teachable moment. For instance, there's a news item on teen pregnancy or HIV. You ask them, what do you think about these issues? And listen to them in a respectful manner. You may not agree, and we don't have to agree every time with our adolescent. We just need to disagree in a pleasant and respectful manner. Of course, there needs we need to continue to supervise and monitor our adolescents. Know their friends, activities. Now that they're online a lot, teach them to be respectful, some etiquette. Talk about internet safety. You cannot ban them from using the internet. So you have to make sure that they know how to keep themselves safe. Have rules and consequences, which may be the withdrawal of privileges or grounding. Please avoid physical punishment and avoid constant and hurtful criticism. Please be kind to them always. We are quick to criticize when they make mistakes, but we are stingy with praise. Catch them doing something good. Ignore minor misbehavior. They cannot be 100% compliant. And plan enjoyable activities together and show them that you love them. Why is it so important to have positive family relationships? In a study by WHO using data from 53 countries, it was shown that positive relationships at home and in school and religiosity have been shown to protect teens from early sexual activity, substance abuse, and depression. So in summary, we talked about the physical, cognitive, and psychosocial changes that happen simultaneously during adolescence, and this can be confusing for the adolescent as well as for the adults. We talked about the teen brain that matures unevenly and how prefrontal lobe matures much later than the emotional brain. Psychosocial changes such as identity formation, individuation, a move toward independence may be perceived by parents as a loss of affection, rudeness, rebellion, or rejection. We should understand that these are normal events. And contrary to what we have come to believe, many of what's abnormal during adolescence is actually normal. Studies have shown that about 80% of adolescents cope well with the developmental process. Overall, intractable and major conflict between parents and their adolescent children is not a normal part of adolescence. So thank you for accepting the mission to understand adolescence. I hope I kind of changed your mind about some of your preconceptions about adolescence. Thank you.
Thank you very much, Dr. Emma, for that very enlightening lecture. It's always good to hear the pediatrician's perspective on how we can better understand and manage our adolescent patients. We are very grateful to you for sharing with us your insights tonight. Again, we would like to remind everyone that we will accommodate all your questions at the end of both lectures. We would like to thank our PPDSI working team, the UP College of Dentistry, and our sponsors, Unilab and PharmaHex for facilitating this webinar. Also, please do not forget to complete the evaluation form and the 6-item questionnaire at the end of the lecture. Certificates will be issued only to those who have submitted both. So if everyone is ready and if our second lecturer is ready, we will move on to the second topic for tonight's webinar. Tonight's second lecture will build on the insights that we have gained from the previous talk. The lecture will focus on discussing the oral health problems that are unique to adolescents and a review of the anticipatory guidance based on the AAP Bright Futures recommendations. The session will be rounded off with tips on how to make one's approach and practice adolescent-friendly. Our next lecturer completed her medical degree at the Pamantasan ng Lungsod ng Maynila. She underwent fellowship training in adolescent medicine at the Philippine General Hospital. She is a diplomat of the Philippine Pediatric Society and she is currently a consultant at the Department of Pediatrics at Binakayan Hospital and Medical Center in Kawit, Cavite. She is a visiting consultant at the Department of Pediatrics at Perpetual Health Medical Center, Las Piñas. Join me in welcoming our second lecturer, Dr. Miriam Joyce Domingo Valenzuela.
Much for that kind introduction, and good evening, everyone. I just want to take this time to thank Philippine Pediatric Dental Society for the invitation. So I will just share my screen. Can you see my slides?
Yes, Dr. Miriam.
And okay, so I hope you can hear me clearly as well. Okay, so we have learned from the lecture of Dr. Llanto that adolescence is a critical period that presents with great opportunities and significant risk and dangers. A lot of people, including parents, teachers, healthcare workers, even pediatricians, find it difficult to talk to a teenager. For our dentists in this room, I'm sure that you are not exempted and you also encountered unique challenges when dealing with teenagers. That's why this evening, we're not just going to talk about adolescent oral health, but we will also present practical ways on how we can make your practice adolescent friendly and hopefully address some of these challenges. So here are the objectives of this lecture. And this will be the outline. First, we will discuss the main health issues affecting adolescent oral health, enumerate common oral health problems among adolescents, and then we will define adolescent-friendly health services and describe its characteristics and share information that should be discussed when providing anticipatory guidance. Let us begin. Question: what is the name of the current population of adolescents? Is it A, Generation X, B, Generation Y, C, Generation Z, or letter D, Generation Alpha? So please type the letter of your answer in the chat box.
A few responses are coming in the chat box, Dr. Miriam.
Okay. Okay, I'll give you 5 more seconds to answer. Okay, time is up. The correct answer is letter C, Generation Z. Now, may I know which generation do you belong to? Are you a baby boomer, a Gen X, a Generation Y or millennial, or Generation Z? Again, please type your answer in the chat box. Wow, it seems like we're from different generations. I can see some baby boomers joining us in a Zoom meeting. We have Gen X people. I'm actually from Generation Y. But for tonight, let us talk about Generation Z. Let's get to know more about them. So Generation Z are teenagers born from 1995 to 2009. The oldest is 25 years old, while the youngest is 11 years old. They are often called digital natives or screen agers. They are born to swipe, masters of social media. They prefer video messages over texting, and they demand 24 access to the internet. Before the COVID-19 pandemic, this survey showed that 42% of FB users are young people. And the average daily time of social media users from the Philippines is 4 hours. So that makes our country number one in terms of daily time spent using social media. The global average is only 2 hours per day. And during COVID-19 pandemic in April 2020, 64% of internet users from the Philippines reported spending more time using social media. So meaning it's more than 4 hours per day. Although it's not surprising because of ECQ and nothing else to do, we should still be concerned about this. Why? Because too much screen time means less time for physical activity. And less physical activity, as we all know, has negative effects on health and well-being. A survey by FNRI in 2018 showed that a large proportion of Filipino adolescents are insufficiently physically active, which means that they spend less than 60 minutes in doing moderate to vigorous intensity physical activity per day. More young people eat unhealthy food. About 1 in 4 Filipino youth drink soda, eat cup noodles, and chips at least twice per week. This is important to note because unhealthy diet contributes to poor oral health. Because of this lifestyle of insufficient physical activity and unhealthy food habits, many Filipino adolescents are not growing healthily. They still suffer from the triple burden of malnutrition. 11.3% of Filipino adolescents are wasted, 26.3% are stunted, while 11.6% are overweight or obese. On the other hand, 11.4% of pregnant adolescents are nutritionally at risk. Poor nutrition compromises adolescents' growth and development. So substance use begins during adolescence. 1 in 5 of Filipino high school students who participated in this survey are current smokers. Are current drinkers, while 50% of those who ever drank alcohol started before age 14. Tobacco and nicotine use also affects oral health. Roughly 1 in 10 are current smokers, while 15% had used any tobacco products, including vaping. How about drug use? Although only 7% of high school students said that they use marijuana, 80% started using drugs during early adolescence, again before age 14. Physical violence among Filipino youth are prevalent, and there are actually more aggressors than victims. Among high school students, almost 50% had experienced bullying. So this psychosocial issue is important as it affects mental health and heightens body image issues, which may have implications on their oral health needs, specifically aesthetic concerns. Cyberbullying is also prevalent. So this data is pre-COVID-19. So it could be greater now during this pandemic. Nearly half have ever experienced cyber violence, and while 80% have been cyberbullied, through social media. It comes as no surprise that there is an increasing burden of mental health problems among this age group. According to WHO, 50% of mental health conditions start by 14 years old. Behavioral concerns may contribute to poor health-seeking behaviors and adherence to dental health plan. Local survey had shown that 12% of high school students seriously considered attempting suicide, 11% have made plans, and a larger proportion, 17%, had actually attempted. More Filipino youth engage in premarital sex. So, in a survey conducted in 2013, the prevalence rate is at 32%, and this has steadily increased in the past 2 decades. 23% 23% engage in sex before 18 years old, and 7.3% engage in FUBU, and 3.5% had casual sex. You might say that anyway, the prevalence rate is relatively low. Why should we be concerned about it? Well, it is because that 78% of those who engage in sex had not used protection against unintended pregnancy and sexually transmitted infections, including STI, HIV, and AIDS. So in 2017, 1 in 10 women aged 15 to 19 years old have begun childbearing. Our country loses about 33 billion pesos every year due to teen pregnancies alone. Adolescents living with HIV and AIDS are also increasing, and this is related to their sexual risky behaviors. So recently released data from HARP showed that 5% of newly diagnosed cases were adolescents, and all were infected through sexual contact, commonly by MSM, or what we call men having sex with men. Latest integrated HIV behavioral study by DOH showed that among males and transgender women who have sex with males had engaged in oral sex earlier than anal sex. So why is this important to discuss all of these issues among adolescents? Well, it's because adolescent risky behaviors affect oral health. Sexually transmitted infections have oral manifestations such as oral thrush in immunocompromised patients, like people living with HIV, lesions caused by herpes infection, syphilis infection, and even human papilloma virus infection. Not all oral lesions are caused by sexually transmitted infection. So let us not be judgmental. But it is important for us to recognize these lesions during dental health visit, as it may offer opportunity for you to prompt the adolescent to seek medical care and treatment. Adolescence also marks a period of significant caries activity for many individuals. This can be explained by physiologic, environmental, and social factors. Traumatic injuries to permanent teeth, secondary to fall, traffic accidents, physical violence, and contact sport are also common. Teens start to express themselves through body piercing, but intraoral and perioral piercing may have dental health consequences. Severe enamel erosion is another problem seen in eating disorders, specifically bulimia. Tobacco and nicotine use can cause stained teeth, bad breath, periodontal disease, oral cancer, and whitening of oral mucosa. It also affects healing after tooth extraction and gum surgery. Adolescents also have a higher prevalence of periodontal disease, This can be secondary to the rise of sex hormones during puberty and other behavioral factors such as poor brushing and flossing habits. Occlusal problems with associated disfiguration, aesthetic concerns such as tooth whitening, removal of stained areas or defects, and behavioral considerations such as in the case of anxiety, phobia, and intellectual disability are also common concerns. Because of these health issues and special concerns in this age group, the American Academy of Pediatric Dentistry recommends supplemental medical history regarding questions focused on psychosocial issues enumerated on this slide. These issues can impact the health status of the oral cavity, influence care seeking, and compliance. This also presents a chance for the teenager to be linked to holistic care. The problem is, in general, teens do not want to share sensitive information. What are we going to do now? How can we make our practice adolescent friendly? So to answer those questions, we must understand what is adolescent friendly health service. This term was used by the WHO in 2002 as an agenda for change. So during this time, the world has begun to recognize the value of caring for this most often thought healthy population. 10 years later, WHO produced a guidebook as part of a set of tools that that standardizes and scales up the coverage of quality health services to adolescents. In the Philippines, the Department of Health published the first manual of operations for adolescent health and development program. Oral health is included among the health indicators. So to be considered adolescent friendly, health service should be accessible, acceptable, appropriate, comprehensive, equitable, and effective. When you say accessible, adolescents are able to obtain the health services that are available. Acceptable means that adolescents are willing to obtain the health services, while appropriate, it means that the right health services are provided to them. They get the services they needed. Now that we know the qualities of an adolescent-friendly health service, how do we translate them into more practical terms? For your clinic setup, it is important to provide a relaxed, welcoming, developmentally appropriate clinic setup. So staff should be familiar with the developmental and health needs of the adolescents and should adopt an open and non-judgmental attitude. We should also take time to gain confidence in addressing issues related to assent, consent, privacy, and confidentiality. Educational materials such as posters, infographics, and brochures are also helpful. For the clinic appointment, offer a flexible schedule. It may be helpful to provide an after school or afternoon appointment so that the teenagers, although they are having online learning now, they still follow the regular schedule so that the patient does not need to miss their school. And also, consult the adolescent and parents to encourage shared decision making. Here are the steps in adolescent-friendly interview which we apply in our clinic. You may adopt this in your dental practice. So the first two steps are very important as it empowers the adolescent. Unlike in younger children, the first one that we greet is the parent. But for when dealing with adolescents, we should introduce ourselves to the adolescent first. And then we ask the adolescent to introduce the companion. Next is we explain the format of the interview. So the general format is you see the teen and parent together. then negotiate to see the adolescent alone, and then call in the parent or companion at the end of the interview or the procedure that you're going to do after you have discussed the plans with the teenager. The interview and the physical exam may be different for dental practice, but towards the end, it is important to discuss the plans with the adolescent, and after that, you will call in the parent and set up a follow-up date. Assuring adolescents, by the way, about confidentiality is important as it increases their willingness to seek care and to share sensitive information. So here are 10 principles in approaching adolescence. First, we should use active listening skills, acknowledge the concerns of the patient, and refrain from giving your judgment and advice without first getting permission. Take time also to explore behavioral context and be mindful of nonverbal cues and do not use medical jargons. Act as an advocate. Help them arrive at their own decision and promote the patient's personal responsibility for their oral health. Lastly, function as a concerned adult who is non-judgmental when listening, advising, and providing guidance. Do not act like a parent. In as much as we encourage also using adolescent-friendly approach, avoid a peer role. Be professional. A lack of formality and sense of humor may be inviting, but dressing and talking like a peer are not. Avoid stereotyping as well. When um, when conducting psychosocial interview and providing anticipatory guidance, always use a strength-based approach. Affirm good behaviors and address risky behaviors. If there are issues that you cannot address or it's beyond your scope, please do not hesitate to refer them to their pediatrician or adolescent medicine doctor when necessary. When encouraging behavior for change, behavior change from patients and families, use shared decision-making strategies and motivational interviewing techniques. So there are actually videos available online for this. Do not assume that the adolescents know the proper way of brushing and flossing. So please patiently demonstrate these skills to improve desired outcomes. Since we are dealing with Generation Z, let us take advantage of using other tools and even online resources. And lastly, because they are concrete thinkers, especially the younger adolescents, consider providing a written dental health plan. Always send your patient home with a smile. So wrap up plans and provide anticipatory guidance. Help them understand the importance of daily oral health hygiene, limiting soda and sweetened beverages, reducing in-between meal snacks, and using a mouth guard during contact sports. And begin conversations with about smoking and drug use. So as I end, I would like to remind everyone that adolescent oral health is beyond taking care of their teeth and gums. Psychosocial issues and other social determinants of health must be addressed. Your investment in adolescent oral health by applying adolescent-friendly health service standards in your own practice will surely go a long way. Your participation tonight, in this lecture is actually an investment to adolescent health. So with that, I would like to thank you all for listening.
To thank Dr. Miriam for a very practical and relevant lecture. I'm sure all of us here will be able to apply to our own practices whatever tips you have given to us tonight. So we're done with both lectures, and then we have a few questions from the floor. If both of our lecturers are ready, we may proceed with the question and answer. So we'll start with the question and answer. I think the first question is for Dr. Emma. The question states, would it be all right as well to help the adolescent temper the need for peer relationships in favor of introspection and self-formation?
I think this can be done. Um, it's not a dichotomy. It should be something balanced. No, I wish we had a more concrete situation in which these two decisions have to be made. No, so I think if I may rephrase the question, so uh, is there to strike a balance between peer relationships and introspection? Is that correct? Did I understand that correctly?
Yes, based on the question, that's what she's trying to ask.
Um, I wish that we could have a clear example. It seems very abstract to me. I'm sorry. So the question here is, could 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 you read it again? I'm sorry.
Sige po, I'll read the question again. Would it be all right as well to help the adolescent temper the need for peer relationships in favor of introspection and self-formation?
Okay, yeah. So I guess my answer was, again, striking the balance. And it seems that the one who's answering is that she's concerned that maybe, this is how I get the question. It sounds like there's a concern that maybe the peer influence may be too strong and may lead to something negative. And so it's better to kind of learn about oneself using introspection and some other way. That's how I understand the question. So what I mean is that, I'm sorry, is that it is not an either or question. You can do both, no? And again, to strike the balance between that, relationships with a peer and some quiet introspection on your own. But adolescents actually tend to think very inwardly, no? They have the capacity to be introspective and to think things through, to be able to, because they're starting to engage their abstract thinking, no? So ang ano lang dito is that we don't make it a choice between their friends and, you know, the family or some other introspective activity, no? So try to avoid that power struggle na it's either your friends or ito, because the adolescent needs both relationship with peers as well as time to be introspective and to learn about himself or herself on her own. So that's the best I can answer the question with.
Thank you very much, Dr. Emma. For our next question, I think this is also for you. For teenage boys who should initiate the talk about masturbation, wet dreams, sex, and the like, should it be the father, mother, or both?
Okay, so the thing is that they say parents, so ideally both parents should be comfortable, but it seems that the boys will be comfortable with the father. So that conversation may be less uncomfortable if it's the dad talking to the boys, because it's going to be very, very awkward if it's the mom. But it doesn't mean that the mom cannot do that conversation either.
Follow-up question, Dr. Emma. Yeah. What's the best way daw po to start the conversation?
Well, the best way to start a conversation is when they're small. And it starts as simply as naming the genitals with the proper names. No, so it's penis, it's vagina, it's not flower, it's not bird. It is important that they do not feel that these parts are any different or dirty, no? Because that's, and so we use all these euphemisms. It has also implications actually in child protection. Because if they don't know the names of the parts, they'll say na, my uncle loves my flower, or he likes to smell my flower. So so that also has implications in child protection. But again, no, so sexuality education should start during, as early as toddlerhood or babyhood, no? And when they're young, we should be comfortable talking about the body parts and the body functions. And so how is it initiated? It's not comfortable. I mean, we're not used to talking about this, and I admit that even as a doctor, it was difficult for me to talk about it. No, nobody taught us. But there are so many resources now online that can aid us in making the conversation less embarrassing or less personal. I would like to point you to a resource. We call it, it's called kidshealth.org. It's actually a website that's sponsored by the American Academy of Pediatrics. And you go in there, and the topics are divided and curated so that it's the same topic, but it's appropriate for children, for adolescents, and for parents. So key in puberty, you read it on your own, and then you share it with your child. And start early. Don't wait until they're 13. Wala na. All the pubic hair, all the changes have started. So as I mentioned, for girls, it starts as early as 8. So as early as 7, start talking about the possible changes. Now, it makes it less awkward than when you're talking to them when they're already fully grown. So that's my ano. So use the online resources. I used books because we didn't have online things at that time, but I used books that I would share with my kids. If I had a lecture, for instance, on adolescent sexuality, I'd kind of show it to them and kind of explain some of the slides. So, and it's not a one-time conversation. So these conversations have to start and to continue, no? And the quality and the type of subject matter will differ as they grow older, no? So please visit that website. I know it's not easy to talk about these matters, no? Sexuality is always kind of taboo in our society, but it's about time. Or else, where else will they learn about sexuality? They learn it from the wrong sites, no? They can go to pornography, they can ask their friends, or equally ignorant. So you have the responsibility to give them the right information. At the same time, also accompany this with your own values. That are the expectations. Yeah, that's too long.
Thank you very much, Dr. Emma. I think our next question is for Dr. Miriam. My concern is, in times of this new normal where the screen time restrictions are very difficult to implement, how can the parents take a stand and coordinate with the schools regarding this matter?
Okay.
Thank you for that question. I think for the recommendation regarding limiting screen time, it's applicable for using gadgets other than related to education. So if the adolescent is engaged in online learning, that's just fine. No? But for other activities like watching videos, using the social media, so we know that there are many things out there that would affect the adolescent. So it's very important that we guide them, and also instill values. So the question is, how are we going to tell that, no? To advocate for, tell that to the schools regarding that matter?
Yes.
Well, during this pandemic, we have no options. No, this is the best option that we have through online. Even for this meeting, we have it online. So I believe as long as the parents are involved, they orient their children on what to do, what are the rules, and instilling responsibility on them. I think that will be helpful already for the teenagers. I hope I answered the question.
Thank you very much, Dr. Miriam. The next question can be answered by either Dr. Emma or Dr. Miriam. It states, do we have a problem if our children are types who are encouraged to go out with friends? They would always say they prefer to be with us. This is when they were in senior high school and at present.
Okay, so parang it's like reverse, no? You wanna shoo them out because well, for one, I think the one who's answering is I'm sorry, asking the question is very aware of the role of peer relationships, no? And it seems that she's worried that they prefer to stay home. We notice this in a lot of adolescents, and the only reason they want to stay home is they want to stay with their gadgets. So maybe you need to kind of understand why they want to stay home. Is it just because they just want to play with their gadgets, or they don't get along with their friends? Kind of try to understand what's really going on, what's behind that behavior, and take it from there. No. If they're staying home because they want to play with their gadgets, baka you can really talk to them about having a balance of activities. As Miriam said, having a balance of activities, and although it is quite difficult because of we have to stay online and we stay home, and the options of going out are very limited. So please just when we come out of this isolation and it's still the same behavior, try to understand why they want to stay home and not go out with their friends, because it's normal to want to be with your friends.
Thank you very much, Dr. Emma. Our next question is for Dr. Valenzuela. In our current pandemic context, where we tend to maintain the physical distance by online health consultations, how do we initiate and maintain professional relationships with our adolescent clients?
Thank you. Thank you, Louie, for that question. So I think this is about telehealth consultation with adolescents. Well, there are many restrictions and limitations no, when you do telehealth consultation with adolescents. I think it's very important that we still adhere to the principles. Although the platform is different, the principles should still be there. With regards to the steps in adolescent interview, actually, when doing a telehealth consultation, we can always discuss the rules. We can also discuss the flow of the consultation so that we can guide the adolescent, and also perhaps to shorten the encounter through online platforms. We can do advanced screening by providing perhaps checklists that they can answer, that you can also review on during your private time, and then you go ahead with your consultation with the teenager. How can we maintain professional relationships? Perhaps by I think for telehealth, we are encouraged to still come prepared. We practice website manners. We ensure that if we're on a video conferencing, we have the proper background lighting so that we would appear professional to the adolescents. I think that's my answer. Thank you.
Thank you very much, Dr. Miriam. Our next question is for Dr. Emma. If my adolescent patient discloses some very sensitive information about his or her parents, do I keep this information confidential, or am I obliged to consult with other specialists? If yes, how do you suggest I go about it?
So again, this is how I understand the question. The adolescent discloses something about the parents. And the question here is that, is there an obligation to do consultations or to break confidentiality? Now,
Yes.
It all depends on what sort of information was shared. And it's important, I think that was emphasized by Dr. Miriam, that that confidentiality should be discussed as well as the limits. Because this is a minor, and minors need the protection pa rin, no? So if for confidentiality sa practice namin, there's an exception. So you will keep everything confidential and private except in instances when there is abuse, if there's threat to self, there's suicidal ideation or even attempt, or the adolescent plans to harm somebody else. So when these situations arise, you may break confidentiality, but usually we try to negotiate with the adolescents. We need to inform them. You cannot just disclose without talking to the adolescent. No? So it's very important. I think part of your practice na you talk about confidentiality, but there are limits, and the limits are safety. No, so for instance, that I can only speculate kasi what sort of issues is it like? The child is being abused by the parents? Because in that particular case, we as medical personnel or healthcare workers are obligatory reporters to child protection. So I'm only speculating kung ano yung information, no? So for instance, information that the parents are fighting, you don't need to do anything, report to anybody, but you need probably to talk to the adolescent how it affects that adolescent, no? I could probably answer that question in a more granular way if I know the situation, but in general, those are the limits that we set for confidentiality when it comes to adolescent healthcare. I hope I was able to answer the question. Those are difficult questions.
Follow up, Dr. Mary Ann. The person asking the question was stating this as an example. For example, the adolescent is doing some dieting that's harmful to his body.
Okay, yeah. In that particular case, so the question dito sa mind mo is the safety at risk, especially if there are already changes in the tooth enamel. That means that the behavior has been going on for some time, and so puts the adolescent at risk. So we will negotiate with the adolescents to notify the parents because we're talking about the safety of the adolescent. For instance, it's bulimia, it's vomiting. Then you have to negotiate with the adolescent about disclosing to the parents.
Thank you very much, Dr. Emma. Our next question can be answered by either Dr. Emma or Dr. Miriam. What is the difference between being an authoritative and a strict parent?
Okay. Sige. Yam, would you like to answer that?
I think there are different parenting styles, no? Authoritative and authoritarian, no? Being strict is different from being firm. We encourage being authoritative over being authoritarian. So in dealing with adolescents, since they are emerging adults and have evolving capacities na rin po, no? So we already talk to them always in a respectful manner. We don't prescribe, we don't dictate. We always ask their opinions so that they would feel respected as well. And support also their transition to adulthood.
Thank you very much, Dr. Miriam. Our next question is from Dr. Paul Abaya. What do you tell overprotective parents if you need private time with the teenagers or give the teenager the chance to express themselves? Either of you may answer the question.
Yam, that's yours.
Doctor, is it okay to repeat the question?
Sige po. What do you tell overprotective parents if you need private time with the teenagers or give the teenagers the chance to express themselves?
Is it in the context of a clinic visit? Well, if it is, yes, ma'am, yes. If it is,
in the context of a clinic visit.
Okay, in the context of a clinic visit, that's why it's in our practice, which you can adapt also in your practice, we explain at the onset the format of the interview. And then we explain both to the parent and the teenager, why the principles behind why are we doing this thing. And the first step in greeting the adolescent first before the parent also already sends a signal that the patient is the adolescent, not the parent. So I think that's my short answer for that question. Ma'am Emma, would you like to add?
Yeah, Dr. Paul, it also entails the transition of your approach, no? It entails transitioning your approach. So preparing the parent also to kind of let go. So it can't just happen like overnight or abruptly. So you know when the child becomes like 9 or 10, tuwi na yon papunta na yon. So you start discussing na at some point, I'll be talking to your child alone for some time. And then, so there's also some preparation on the part of the parents kasi so that they don't feel like they're left out or excluded kasi that's what parents don't like.
Thank you very much, Dr. Emma. For our next question, either of you can answer it as well. When or how would the Data Privacy Act affect us dentists when dealing with adolescents, specifically children aged 18 to 19 years old?
The data protection. Okay, so this is what we're doing in PGH kasi we're also coming up with the guidelines. No, this is something really new for everybody. So the first thing that's so important and before you start anything is actually to get an informed consent. And so what is an informed consent? It's talking about the benefits as well as the limitations of the consultations. It tells them that the information will not be shared unless there needs to be some consultation. So, and then, this will not be recorded, and please do not record. And really on your part to make sure that the data that you get from the patient is secure. Now, in the States, they have the HIPAA compliant platforms. Now, one of that is DoxyMe. But in the Philippines, since our patients do not have gadgets or access to apps that are HIPAA compliant, that means the privacy is really assured. We are still allowed. It's not indicated it has to be HIPAA approved. No, so right now we are using in PGH mobile calls through mobile phones, Messenger, Viber, when we need video calls, and some can afford Zoom meetings. No, so all of these are not really strictly approved. Sana if you were in the States, no, but in the Philippines it's still allowed because especially in our patients in PGH, they cannot afford any other platform. So the data privacy, you have to read through it, and I advise that your society also go through the steps. No, there are some. I can probably email to Paul the guidelines that were done between the UP College of UP Manila as well as the DOH. No, so this is the joint memorandum circular that details the data privacy issues and the guidelines in terms at which Miriam mentioned the website manners. No, so this is an ongoing. We're still coming up with guidelines that are specific for pediatrics. I really advise that you also come up with your own guidelines, which is specific for your specialty. And I'm willing to share whatever we have.
Thank you very much, Dr. Emma and Dr. Miriam. I think that would be our last question already. So at this point, I would like to thank you for sharing your time and your expertise with us. And I would also like to present the Certificate of Appreciation to tonight's lecturers. If we may have it on the screen, please.
Okay. I see it.
So let me read the certificate. The Philippine Pediatric Dental Society, together with the University of the Philippines Manila College of Dentistry, presents this certificate of appreciation to Dr. Emma Alesna-Llanto in grateful recognition of her participation as guest lecturer and for sharing her expertise and knowledge through the topic Understanding Adolescence Mission Possible, given this 28th day of August 2020 during the PPDSI String of Pearls webinar series. Signed, Dr. Paul Abaya, PPDSI President, Dr. Danilo Magtanong, Dean of the UP College of Dentistry, Dr. Rowena Castro, Awards Committee Chair, Dr. Jean Arevalo, Coordinator for Continuing Education, and Dr. Hazel Talasunico, Scientific Committee Chair. We would also likewise present the Certificate of Appreciation to our second lecturer, Dr. Miriam. Allow me to read the certificate again. The Philippine Pediatric Dental Society, together with the University of the Philippines Manila College of Dentistry, presents the Certificate of Appreciation to Dr. Miriam Joyce Valenzuela in grateful recognition of her participation as guest lecturer and for sharing her expertise and knowledge through the topic Adolescent Oral Health, Tips on Making Your Practice Adolescent-Friendly, given this 28th day of August 2020 during the PPDSI String of Pearls webinar series. Signed, Dr. Paul Abaya, PPDSI President, Dr. Danilo Magtanong, Dean of the UP College of Dentistry, Dr. Rowena Castro, Awards Committee Chair, Dr. Jean Arevalo, Coordinator for Continuing Education, and Dr. Hazel Talasunico, Scientific Committee Chair. On behalf of PPDSI, the UP College of Dentistry, Unilab, and PharmaHex, we would like to thank our speakers for tonight, Dr. Emma Llanto and Dr. Miriam Valenzuela, for taking time out from their busy schedules to share their knowledge and expertise with us. We are very grateful and honored to have you with us today. We would like also to thank all our colleagues who were able to join us tonight. We are all very honored and privileged to have you with us. Thank you very much, and we look forward to seeing you in our next lecture on August 31st.